This donning procedure assumes the facility has allotted an N95 respirator with a coverall, has established protocols, and facilitates training and compliance. The trained observer. Use a trained observer to verify successful compliance with the protocol. The trained observer in the donning process is a dedicated individual with a sole responsibility of ensuring adherence to the entire donning process. The preparation. Before starting the donning procedure, change into clean surgical scrubs or provided disposable garments and dedicated washable footwear in a suitable clean area. All footwear should be closed-toe and closed heel with no decorative holes. No personal items such as jewelries, watches, cell phones, or pens should be brought into the patient's room. Ensure hair is pulled back away from the face and off the neck and back. Ensure that your nails are no longer than 1/4 of an inch so that they do not puncture your gloves. Performing hand hygiene. Before doing any procedure, ensure that the entire hand is completely clean and dry prior to the donning procedure. Put on the boot covers. Make sure that all areas of the foot are covered and the boot covers are snugged over your ankle. Try not to touch the floor or other areas with your hands while putting on the boot covers. If you do, disinfect your hands before putting your inner gloves on. Put on the first pair of gloves. Make sure to get the cuffs of the glove as far up as possible. Put on the coverall. Ensure that the coverall is large enough to allow freedom of movement. Pull up the zipper completely. Ensure the cuffs of inner gloves are tucked under the sleeves of coverall. Put on the N95 respirator. Hold the respirator in the palm of your hand with the straps facing the floor. Place the N95 respirator on your face, covering your nose and mouth. Pull the bottom strap up and over at the top of your head and put it below your ears. Take the upper strap and put it towards the crown of your head. Mold the nose piece of the respirator over the bridge of your nose to obtain a tight seal. Perform a fit check of your respirator to ensure there is a good seal against the skin. Put on the hood. Make sure that the hood completely covers the ear and neck. Using your apron. If the patient is having vomiting or diarrhea, put on a single-use, fluid-resistant or impermeable apron that covers the torso to the level of mid-calf. The apron provides an additional layer of protection to the front of the body against exposure to body fluids or excrement from the patient. Put on the outer gloves. Double gloving provides an extra layer of safety during direct patient care and during the personal protective equipment removal process. It may be necessary to ask your trained observer for assistance in putting on the outer gloves. Consider taping the sleeves of the coverall in the outer gloves to prevent potential skin exposure from separation. A tab should be created by folding the tape over at the end. This tab will help facilitate easy removal during the doffing process. Care must be taken to remove the tape gently. Put on the face shield. Once the face shield is situated, check to make sure it covers the front and sides of the face and no areas are left uncovered. After completing the donning process, the integrity of the outfit is verified by the observer. Now, we are ready to take care of the patient. Proud to be a Manila Med Health Service provider.